Women are we call them the chief medical officer of the family, right? So they really, they have this radar and this antennae. I don't know what they are, but they are the ones that initiate the whole process. However, they are the ones that take the longer to go to see a doctor. So they just wait for more symptoms to accumulate, and then at some point, they just decide to go.
Welcome to Zestful Aging, where I speak with fascinating people from all over the world, from every walk of life, who will inspire you to live with zest. I'm your host, Nicole Christina, and my mission is to bring you optimism about aging and help you make full use of the new opportunities that only come at this stage of life. To find out more about the podcast, hop on over to zestfulaging.com. And while you're there, sign up for my weekly email newsletter, The Insider, where you will get fun and quirky tidbits about the show and my exploits, including when I went python hunting in Florida and my participation in the National Senior Games. And if you love the podcast, I'd be grateful if you shared it with your friends. Our music is courtesy of Judy Banker, who was a previous guest on the show. Find out more at judybanker.com. And our technical director is Stephen Litweiler. Well, have you ever had any weird physical symptoms and been told that it's all in your head? Well, being dismissed can mean an important diagnosis is missed, and we're also left feeling very alone. Talk to anyone with Lyme disease, mast cell disease, or any immunity disorder, including long-term COVID, and they will tell you their stories of years and years of misdiagnosis. So in addition to feeling unwell, they also can feel crazy. Today, our guest is going to talk with us about bridging immunology research with gender medicine. Her work is about understanding how the immune system affects the brain and how to develop an effective therapeutic plan that's also based on gender of the patient, because one size does not fit all. Maria Teresa Ferretti is a biomedical researcher, a TEDx speaker, and the founder of the Women's Brain Project. And she's coming us today from Vienna, Austria. Welcome to the show, Maria.
Thank you so much. I'm delighted to be here.
Thank you so much. Oh, you have so much to help us with. There's so many pieces that we can go into. But first, I'd like to ask you if you could talk a bit about the Women's Brain Project and how that came about and why it was important for you to found that.
Thank you for this question. It's a pleasure to talk about this, because it's not just a project; it's really a passion of mine. So the story is that I was a researcher at University of Zurich. My field was Alzheimer's, an age-related disorder. We might talk about that a bit later. So I was doing my research, and I was contacted by a journalist who wanted to interview me. And I was super excited because at the time I was doing research on microglia, immunity, Alzheimer, and I thought the journalist was interested in that. It turns out, actually, when we got into the interview, she wanted to know why more women than men have Alzheimer's disease. And that, caught me completely off guard, because back then I kind of knew that, yes, there were more women than men with Alzheimer, but I was definitely not prepared to answer that question. I had more or less no idea. I assumed it was something related to longevity, but that was it. And that was it with that interview. And then about a week later, my colleague and also very good friend, Antonella Santuccio-Nechada, came and told me, actually, I was thinking about the sex and gender differences in Alzheimer, and I heard a presentation about it. They are claiming that Alzheimer is mostly female. We should look into this, we should do some serious science about this. And I'm like,
Yes.
And I just, it was something that just struck me as such an important observation that I had never paid attention to myself as a researcher, and actually the field at large was not paying attention to, because I realized that nobody was interested in this. So we started to look a little bit into this topic from a research perspective. We put together a paper that was published in Nature Reviews Neurology. And to make a long story short, we basically created a small group of people super passionate about this topic, and we realized that actually there was a lot to know about sex and gender differences in Alzheimer's. And it was not just about the number of patients, but really about precision medicine. So different symptoms, different presentation, different progression, different biomarkers. Everything was different, and nobody was talking about it. So we decided to create an organization to actually study this, to do some serious science, but also awareness and education and communication and policy and advocacy about these topics. Because, when you start, you just realize that it never ends, because it's not just Alzheimer's. Soon after we realized that in a lot of other disorders, brain disorders, you have these differences between men and women, very significant ones that the clinical community, the scientific community was just neglecting. And so, again, it grew, it's a passion of ours, but it became a non-profit organization that we registered in Switzerland, but we are active globally. And it's an association, so it's largely composed by scientists that largely work pro bono for the organization. I want to highlight that. Really, just because everybody thinks this is, how is it possible we're not talking more about this? How is it possible we're not doing better science about it? How is it possible our policymakers and even the patients don't know about these things?
So, it seems so important for a clinician to know these differences if they're going to be treating these disorders.
Exactly. And so that's why we are basing ourselves on science. So we start from data, and then we publish paper and we talk to our peers, right? We talk to our scientists, but we are also talking to clinicians. And we make sure that we talk to clinicians based on the science that we do, but also based on the insights of a lot of patients that work with us. Because another eye-opening experience that I had working with the Women's Brain Project was actually how different can be the perspective, the experience of a disease if you are a man or if you are a woman. So,
could you talk about that, Maria, just a little bit more? I'm a psychotherapist, so I love the psychological, emotional aspect. How do women and men perceive their illnesses? What are some of the differences in how they experience being ill?
So I can speak a little bit about the psychological part and a bit more about some biological aspects. What we know is that actually it's mostly what we have found actually with our own research is mostly differences in the health-seeking behavior is called and actually the behavior of people when they're starting to have symptoms. So what we have found, for instance, in Alzheimer's, we have done a dedicated study. We really used a survey to ask people, how was your experience with your diagnosis and in your symptoms? And we wanted to capture these differences between men and women. And, for instance, what struck me, something that we found is that actually women are the ones that notice the symptoms in themselves and in the family, in their partner. So men tend to be less, let's say, attentive or less careful in evaluating symptoms. They are not the ones actually picking up symptoms in themselves and in the others. Women are we call them the chief medical officer of the family, right? So they really, they have this radar and this antenna. I don't know what they are, but they are the ones that initiate the whole process. However, they are the ones that take the longer to go to see a doctor. So they just wait for more symptoms to accumulate, and then at some point, they just decide to go. On the other hand,
they minimize and say, oh, maybe it will go away.
Exactly. And they have so many things to do. That's the problem with women. I mean, because they are the chief medical officer of the family, their days are absolutely full, and it's really hard to afford to take a day off just to go and do 2,000 different blood tests and controls and checkups. So they postpone. But they are the ones actually convincing their partners. So when it's the partner that has a man that has starting to show symptoms, they are the ones actually bringing them to the doctor. So they feel, in charge and responsible for the health of their family, and they are the ones taking them to the doctor. While women tend to go either with a friend, a girlfriend, or the daughter, or another female relative to see the doctor for the first visit. It
Is
does,
that
right?
across cultures? Yes. I just interviewed a woman who wrote a book called Sidelined, and I'm actually going to let her know about you. This is precisely what she talks about, is how we are terrible taking care of our own medical needs, but we're great with everybody else, and that has real costs, especially, as we age. But this is so fascinating. You think it's across cultures that women are the chief medical officers?
I do think so. It's a pretty common finding. I was recently on a conference where we were discussing that, and actually I loved it because there was another speaker coming from Africa. I don't remember exactly the country, but he was mentioning that actually in a little town where he grew up, there was a system called the grannies, for health. And so some people having health issues, the first stop you would do is to go and talk to your grandmother. And that would be already, a starting point in the healing process, kind of a committee of elderly women that take care of your health. And that made me think, this might be beyond, not just in our culture, it might be in other cultures as well. However, I have to say that like many other things in my field, unfortunately, we lack diversity in research. So most of the data we have are, related to US and Europe. So this is definitely a question I would like to address with a dedicated study. It's more like a guess mine right now.
Hi, everyone. You may have noticed that Zestful Aging Podcast does not run a lot of ads. That's because I'm just not willing to endorse products that I don't have total confidence in and that I don't use myself. So it really means something when I tell you that after I interviewed Dr. Bill Rawls on cellular health, read his books, and learned about his high standards for quality control, I was sold. I placed an order for Vital Plant supplements immediately. I encourage you to check out both of my interviews with Dr. Bill Rawls and hop on over to vitalplan.com. If you enter Zestful15, they will give you a 15% off of your first order. I'm really excited for you to try these products. I think you'll be very impressed. Now, back to the show. I see. So there's so many layers to this, because you're talking about the brain being different, the symptoms looking different, and then also women having different behaviors around their illness.
Mm-hmm. And even more, if I wanted to give another example coming from a disease like Parkinson, but it's very similar in other disorders, especially immunological ones. Symptoms can be different for women across their menstrual cycle. Something that women know, and basically nobody talks about it and nobody does anything about it. So women living with Parkinson, but also diabetes, also migraine, also myasthenia gravis, also multiple sclerosis, like a long list. They all notice the same, and this is also documented in the literature. It's known in the clinical community that symptoms tend to fluctuate around your cycle and tend to worsen either the week of your cycle or the week before. So the result of this is that when a woman is suffering, especially with these chronic disorders, there is 1 week per month when she's going to be predictably, so she knows that she's going to be terrible, that her drugs will not work, that she can't just work, that she's KO, they say here in Vienna. And most women just accept it as a fact of life. The women that try and talk about it with their doctors, in most cases, doctors reply, we have bigger issues. This is not an issue. And actually, first of all, it's not clear in many cases what is the biological reason behind it. It's most likely hormonal, of course, but we don't really know exactly how it goes. So I find it scientifically a very interesting question. But then also from a clinical perspective, you were saying how important it is for clinicians to know this, how important it would be to have guidelines, to have a doctor that knows what to recommend to you, to adjust your treatment for that 1 week where you're going to be miserable. And why should you just accept that you're going to be miserable? Why should we? This is something, I'm very passionate about this because I think there are gendered expectations in our society where we just expect women to live with pain and to be fine with it, we are going to be in pain for 1 week a month, and that's just okay. You just have to be brave and,
don't complain.
And don't complain, exactly. And if you complain, you're weak. But then maybe it turns out, especially women with excruciating pain during their cycle, it turns out maybe they have endometriosis, and that's not normal, But we are, my impression, and I would like to hear what you think about this, is that we are raised with this idea that pain is part of our biology. We just have to accept it and not complain about it and just live with it and just wait for it to go away. And I strongly resist to this idea, So I really think if we know that 1 week, those women with, let's say, early onset Parkinson are going to be miserable, we should be doing something for them. We should definitely help them. And I'm trying to convince clinicians to start having consensus about this.
Well, you're talking about taking women seriously, which is a huge subject, right? About sexism that goes back a long, long time. Yeah. But I can see that, embedded in what you're saying. Could you talk a little more specifically about how Alzheimer's shows up differently in women and men?
Yes, very happy to do that. So Alzheimer's is the most common cause of dementia and cognitive decline in the elderly. So we are talking about a cognitive decline that actually interferes with your daily activity, not just you're forgetting your keys or you can't find names or words. We are talking about serious impairments in your cognitive functions. That being said, the type of symptoms and the progression that you have with Alzheimer's can be different between men and women, and there's quite a lot of literature now showing that. What we know is that even though men and women might have the same amount of pathology in their brains, so there is a neurodegenerative process, right? So there are neurons that are basically dying in our brain, or they are very sick, and this is the same for men and women. Even if they have the same amount of neurodegeneration in their head or the same amount of pathology, actually the symptoms show up differently. And what we know is that especially in early stages, so when the pathology is just starting to manifest itself, women tend to, let's say, mask. We're not 100% sure that's the thing, but they just perform better. So when you test their memory, they will still do great. And with the same amount of pathology, men will show up with symptoms, So what we are finding is that it's particularly hard to diagnose an early Alzheimer in women because they outperform men in memory tests, in the vast majority of the memory tests that we use. And so the tests are too easy for them and we're not picking them up early enough. We don't know if it's like the tests are too easy, they're masking, they're compensating somehow, but still. And the result of this, I think it's super important from a clinical perspective, is that actually you have this man and this woman, they started from the same point, right? They had the same pathology. The man got his diagnosis of early Alzheimer and, he started treatment and whatever happens. Women go on for a while with their mild cognitive impairment that has not been diagnosed. By the time they finally reach a diagnosis, actually their symptoms are so heavy, so high, that actually they go straight to dementia, so the very, a more advanced stage, and they progress much faster because they are basically more advanced in the disease trajectory. We catch them too late. And this is super relevant in my eyes, especially now that we're finally starting to test drugs that seem to have a potential effect, especially disease-modifying effect. It is super important that you use these drugs at the very early stages of the disease, because if it's too late, it's just too late, not much that you can do. And so I'm really talking to everybody about this difference between men and women, because I'm just afraid that we are going to have drugs that are going to work only in men. And because we are missing all the women in the same disease stage, just because the scales we're using, the diagnostic tools we're using are not adjusted by sex.
I see. Oh, it's so interesting. So are you finding still as you're doing research and I imagine you're applying for grants and all of this, are you still finding fundamental sexism in the science world?
So yes, of course, we are applying for grants and we are, writing papers, submitting papers for publication, it's a tough world in general. I have to say, in general, for scientists, it's really tough to get grants and it's really tough to get papers published. I am aware there is a lot of literature on sexism and various types of gender biases in this field. More than a direct experience with that, I am more aware because of first, let's say, very close experience of still a lot of biases and there's an English term for that, but I can't remember it exactly. When you have this
discrimination.
No, the old professor. So picture just the old professor, old male white professor who's a big name in the field that talks to the young, coming up researcher, female, does whatever he can to make her feel small, and possibly humiliate this little girl. So this is something that I've seen.
Wow.
I can also tell you that
you're in a male-dominated field.
Largely, even though whenever I go to conferences and I look around myself, I see more and more women, but they are in the audience. That what bothers me. So I'm waiting for the moment that all those women that right now are in training and they are in the audience of these conferences, they will all become big shots, big professors, and they will be finally taking the stage. So I think this is coming. Right now, it's still a lot of women in the, let's call them lower ranks, right? So the students, the postdocs, the researchers, assistants, and the big professors, the big shots are a lot of males, even though we are starting to have some stellar, absolutely outstanding researchers, especially in my field, in Alzheimer. We have a beautiful network of female professors. And the important thing, and this I'm very passionate about, it has been shown, like really with research and with data, that actually women, so the more women you have in a leading position in a research group, the more likely is the research group to be studying or including sex and gender differences in your your research. So the more women are definitely more interested in this topic, more sensitive to it, more tuned to it. So the two things go together.
Sure.
If we definitely need more research in this, and at the moment, it's mostly women driving this type of research. So we need more women doing this type of research, but we also need more men. I'm hoping that at some point also men will understand that this is an interesting topic for investigation. It's not just a topic for women. It's for everybody, right? It's precision
It's the
medicine.
differences. It's important to see the differences.
Exactly. It's giving the right treatment to the right person at the right time. And if you're a man or a woman, it makes a difference.
Are you feeling optimistic as you continue to do this research, or are there times, are there times when it's hard to feel optimistic because of the culture that you're describing?
So I can tell you the very first time that I presented the idea, I told you I was a researcher at the University of Zurich, and I was starting to think of this idea of the Women's Brain Project, and I actually presented it in a meeting with some of my colleagues and some external speakers as well. It was like a retreat. And it was really just the last slide of a very long presentation in which I presented all my findings, my microglia things, immunology, blah, blah, blah. And then the last slide kind of outlook, what I'm thinking of doing in the future. I think these differences between men and women are interesting. I'm thinking they could be, we could study them in maybe immune markers, a couple of bullet points of things that I found interesting. Jesus Christ, the reaction to that, you have no idea.
People stand up and start cheering for you?
No, I wish. Back then, that was 2017 or it must have been 2017 or 16 or 17.
Yeah.
No, the big
opposite.
professors in the room, they all told me, this is nonsense. I never heard about this. There are no differences in Alzheimer's between men and women. Actually, women have it the best. They live so long. They're totally fine. What are you talking about? Why should we do research on this? And blah, 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 blah. And so I'm optimistic because almost 5 years later, I can tell you some of the professors that were there actually now are doing this type of research. They have started to... and there is actually, whenever I present these results, the reaction is much different. Of course, in some environments, yes, people stand up and cheer and they're super supportive. In some others, I just see people listening very carefully and, thinking like, maybe this is something. And I know I put like a little seed there. So I'm very optimistic because in general, in the medical community, the attitude has changed. There is much more attention in these topics. There are a lot of young women that are women researchers that are super passionate about these research topics. Many of them working with us, so a big shout out to the team and that they are just fantastic and outstanding. So, but I am an optimist by nature, so I might not be super representative, but still I'm optimistic.
Mm-hmm. So you're on the cutting edge, and it sounds like that's had upside and downside.
Yes, absolutely. It's a roller coaster.
A roller coaster.
Yes.
As we're wrapping up, Maria, are there any things that you'd like to share with our audience who are women who are either just starting menopause, they're in menopause, that could be helpful in terms of lifestyle or choices that we make?
Oh, thank you so much for this question. It's one of my favorite ones.
Good.
Well, of course, my focus is brain health and prevention of cognitive decline and dementia. So that's what I'm thinking most of the time. And that's where my thoughts are going right now. Menopause is one of those critical moments in our life where there are dramatic changes in our hormones. It's the same during puberty and, of course, a mini reproduction of what happens during the menstrual cycle. So when hormones change, there can be, let's say that there are windows of vulnerability. So puberty and menopause are periods when women are more vulnerable and they can develop risk for a number of disorders. So this can sound scary, but I really, the message that I want to send to our listeners right now is not to be scary about it, just to be informed. I think the more you know and you understand about what's happening in your body and what you should just be, on the lookout for, just knowing that this is a very special period in your life. Don't be scared about changes. Talk to your doctors if you notice anything, and know that, especially for brain health, there are so many things that you can do to take care of your brain and prevent cognitive decline and dementia. So think 40% of cases of dementia are actually, in theory, they are preventable with just modifying our lifestyle. So we are talking about modifiable risk factors for cognitive decline and dementia. So the same way we know that we can reduce our risk of cancer, reduce our risk of heart attack with good habits, is the same for our brain. It's exactly the same thing. So we have the power to reduce our risk. It's a no guarantee. Unfortunately, nobody can guarantee you anything, but you can reduce your risk. And there are so many things that people don't know about. So of course there is the usual thing with the diet and the exercise, and the smoking and the alcohol. These things most people are aware of. But for instance, did you know that traumatic brain injury is a risk factor for dementia? So traumatic brain injury is when you hit your head very badly. And that happens, that is the simplest thing is just wear a helmet whenever you are, going on a bicycle or if you're skiing, because that's when we have accidents where we actually hit our heads. Even that is a very important thing to prevent dementia, for instance, later on. Or hearing problems. So midlife, having hearing loss or hearing, let's say, decline in your hearing skills during midlife is also a risk factor, a very strong risk factor for dementia later on. But the risk factor goes to zero if you use a hearing aid apparatus, let's say. So there are a lot of things that we can do to take care of our brain, especially in this special period during menopause, and start investing in our brain health for the next 20, 30, 40 years. And it's not too late to do it, actually. We should all be doing it.
What are the things that you do particularly with the focus on preventing brain decline?
Me, myself, in my personal life,
Yeah.
you mean?
Yes. Yeah.
So now is the moment of confessions. No, so one thing that I incorporated in my routine, and it's making really a lot of a difference for me, and I keep talking about it to everybody, so this is no secret, is exercise. Because I find, I know that this is good for my brain and it's preventative and all that, but I find that it really helps calming me down. So with anxiety and stress, it really helps me. A bit of like 30 minutes, 40 minutes of cardio. It has a very strong effect on me. So that I'm doing definitely. And then the other thing, and this is also a call to action to our listeners, keeping your brain active, which is not just doing Sudokus. All respect for Sudokus, those are important. But what I mean is really engaging your brain in difficult things, like learning a new language, learning music, getting out of what I do all the time is getting out of my comfort zone. And I accept to do things that I don't know exactly how to do, so that I have to go there and study and really put my brains to it, not just always going in autopilot with the things that I know exactly how to do very well. And that is a way to activate your brain to actually prevent cognitive decline as well. So that's something I highly recommend.
That's interesting. I don't know if this falls into that example, Maria, but I'm 61 and I just learned how to start a fire in my fireplace. My husband taught me, and I thought, this is magical. There's really science to it. You don't just throw the logs on. And I thought, there's a system. You've got to build it. There's airflow. There's, and to me, it was just so delightful because it's not something I would ever venture into. But now I feel like I'm super smarty pants. So it's I don't know if that's what you had in mind, but I was delighted to learn something that seemed really, eluded me as a woman.
That's great. I'm sure that's excellent for your brain.
I hope so. And it keeps me warm. It's such a pleasure to speak with you, and I'm so appreciative of the work you're doing. Where can people find out more about you, Maria, and your work?
So I would encourage everybody listening to us to check our website, www.womensbrainproject.com, and also to follow us on social media. We have our hashtag? Our tag is at Women's Brain Pro. And so you will find us on Twitter, on LinkedIn, on Facebook. We just started a channel on TikTok. And,
oh my God, you're very modern.
I'm not there yet, and my team is super angry at me because I'm also not that modern, to be honest with you. But we are also there. We are starting, so you can definitely, that's a very nice way to follow our activities. We have a lot of projects, scientific projects, but also a lot of activities for the lay public. So I'm sure everybody will find somebody of his or her interest. And if you really want to be up to date and know what we are doing, we also have a newsletter, so you might want to subscribe to that.
Ah, beautiful. And the hashtag was Women's Brain
Pro, Pro. Women's Brain Pro.
PR. Yeah, that's I like that. Well, thank you so much for spending time with us. I really appreciate your work, and it was an absolute pleasure. Continued success.
Thank you so much. Thank you for the invitation, and maybe we'll talk again.
Thank you so much for joining us on Zestful Aging. If you like the podcast, please share it with some of your friends. If you think decluttering could help you feel better and you could use a little assistance with that, check out the online course I've developed with professional organizer and designer Carrie Luderin. It's called Too Much Stuff. And Too Much Stuff is different from other courses or articles or guidance you may have used up. We give you clear steps to deal with the clutter and the tools to help you face the overwhelming feelings and the emotions that come up when we're going through our clutter. And a lot of those emotions are just feeling anxious or guilty or just basically flooded with a lot of different confusing feelings. The course is really practical. It's realistic. The lessons are short and punchy, and they're really manageable. We're not trying to set you up for some long exploratory, super in-depth, burdensome experience. We want something really helpful for you right now. We all need help with our anxiety. So being surrounded by more calm and less chaos can really help. So now's a good time to clear out the clutter so we can focus on what's really important in our lives. So find out more at zestfulaging.com. You'll see more about this under the web courses tab. If you have any questions, just shoot me an email at zestfulaging@gmail.com. Thanks so much. And stay tuned next week for another interview with a fascinating and inspiring guest.